We will definitely be keeping you up to date with what, as and when we get that information as it comes in. So do stay with us right here on KBC Channel 1. Now we want to continue with the day's conversation. And as I had mentioned earlier on in the intro, today we're going to be having a conversation with the Kenya Society of Physiotherapists to just understand what physiotherapy does entail, given that we are also marking the World Physiotherapy Day today. And with us in studio this morning, we have Dr. Catherine Wambua, who is to the extreme side of the studio this morning. She is the Secretary General of the Kenya Society of Physiotherapists. And to my immediate left, we also have Henry Opondo, who is the chair of the Kenya Society of Physiotherapists. Karibu sana.
Thank you.
Thank you for making time to be with us.
Nice meeting you here.
Nice to meet you as well. Thank you, Dr. for also being with us this morning.
Thank you. I appreciate it.
All right. Now, before we get to what World Physiotherapy Day is all about, so many of us have our own understanding of what physiotherapy is. You know, we take it so lightly. We think we know, but we want to hear from the professionals this morning. And let me start with you, Henry. When you talk about physiotherapy, what scientifically, medically speaking, what does it entail?
Thank you so much for having us here. When we talk about physiotherapy, to make it simplest, first of all, it is a branch of medicine, or rather it is a healthcare profession. Now, what does it entail? It entails assessment. Assessment is like looking out into what could be issue with a patient. It entails diagnosing, that is coming up with a concrete idea of what is affecting the patient. And finally, it entails treatment of diseases or disabilities that one person may be presenting with.
Okay. Now, you've rightfully mentioned that it is a part of medicine, but, you know, just let me come to you, Dr. Catherine. Looking at we, the general population, do you think we really abuse what physiotherapy is because we like self-diagnosing and treating ourselves through and through?
Yes, thank you for having us. Yes, I think physiotherapy, in many eyes, what it is not, it's not the massage, it's not the heat, it's not what people say it is. It has evolved just like the rest of the world in terms of science.
Okay.
So we actually use evidence in terms of research, clinical experience, patient values, and interact them to be able to see exactly what is wrong. So what happens is in the population, people use the word exercise as physiotherapy.
Physiotherapy, yeah.
And exercise actually is a good word because the whole body is supposed to be exercised, but that's not right science. So there is the right exercise and there's the wrong exercise. And so now for us physio, we start from health promotion all the way to curative to rehabilitation.
Okay.
And so when we are looking at a person, we are actually looking at what has been researched to find what is the problem, what is the cause of the problem, before you start treating yourself. Because there are some people out there who use the wrong techniques, the wrong, you know, for us, we stayed for many years without being regulated. So there's a lot of people who camouflage as physios who are not. And so I think those are the ones who have given us a bad name of what physio is. But physio is a very deep science. It's scientific based. And so what we want to educate the public is to be able to know what kind of conditions do we treat, how do we treat them,
all right,
so that they can have a better outcome.
And we'll be getting to the details of that. You give us an example of what physio does entail so that we can compare with what you and I may have experienced in the past to understand whether that was physio or self-administering other treatments. But before we get to that, let me come back to you, Henry. You know, as Dr. has said, you know, we like to treat ourselves. Guilty as charged. Now, in your practice as a physiotherapist interacting with other patients, what are some of those misguided conceptions that you have encountered that patients come with about physiotherapy and how it is administered?
That's a very good question to ask. So some of the scenarios I've experienced with patients about the funny myths or misconception about physiotherapy is that, number one, anyone can do it.
Hello.
Two, as just Dr. had said, they think, most of the people think physiotherapy, it's entirely about massage. Massage is not even a component of physiotherapy. you can do massage.
Yes, anyone can do massage. Even my 7-year-old can.
So, honestly speaking, massage is not bad,
Yes.
and it's good. Human love touch, but it's not it doesn't meet any of the clinical tools that we use to treat a patient.
Okay.
Okay. So most of the patient, and with a very outermost respect, they go to gym, workout, and so forth, and they believe the persons in the gym are physiotherapists. So they'll tell you, my physiotherapist told me this, blah, 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 when I was doing these exercises. They actually come to us when it is worse, when now they're in so much pain, maybe they sprain their back and so forth. So if there's anything I can say about misconception is that they have not been able to differentiate what is physiotherapy, what is the scope of physiotherapy versus other modalities that we see in the market
that come masked as physiotherapy. And I also like to hear from you, Catherine, you know, the misconceptions that you have encountered from your patients, especially as you try to just teach them or show them what physiotherapy really entails.
Yes, and mostly I think our clients, our patients come from a position of not having known, and so they use their prior experience. So sometimes patients will come and say, I hope you don't make me feel a lot of pain, because they've had an experience where physio is delivered in a painful method. Or they've had occasions where they were in the hands of physio and it took a long time before they had a resolve. So what we are trying to educate the public is there is defined methods of delivering physio, and every person is very different. So that if you're coming to a physical therapist or a physiotherapist and you had a strained shoulder, and maybe somebody else had a broken ankle, or you had a spinal cord injury, the way we look at how we treat is very individualized, so that it's not one size fits all type of a method where we have found that's the expectation for the public. I'm going to the physio, she's going to give me exercise. That is not the case. If you have a case of a back that has been corrected and you have metal, if I put it that way, in your spine, I'll treat you differently than if you had just sprained your back. So it needs to be, we need to might be demand more from a clinician in terms of the type of physio that is given to the patient.
It's always individualized.
It is very individualized.
Yes, Henry.
Yeah, just to top up on what Dr. is saying, I totally agree. And I think one thing we need to make clear to the general public, that a physiotherapist is not only concerned with your symptoms, but what is causing your symptoms.
The root cause.
The root cause. So this is actually what happens when patients come to us. What they put on their list is to resolve their symptoms. But as we want to resolve your symptoms, we want to establish what is causing this problem, so that we correct the cause of the problem to alleviate your symptoms.
Does physiotherapy have to be painful?
No. That's an old tradition that no pain, no gain.
Yeah, if you don't feel pain, ukisuguliwa, that means you're not recovering.
Hata kusuguliwa ni nini? We don't know that.
As we perceive it.
That's actually just a perception. So these are the people who want to mimic what they saw maybe in a YouTube or in a video somewhere, and want to practice it across the entire population of patients. Maybe they have back pain. But remember, back pain, it could be the same back pain, but the presentation will be different based on individual. For example, you could be having back pain, but what is the cause of your back pain, or what is the nature of your work, versus a person who maybe is a driver. So the presentation will be slightly different. So it becomes a standard pain, that no pain, no gain, when you want to use one concept across the entire population. It has to be customized based on your need. But how do you customize this? Through inclusive assessment. A physiotherapist is empowered, has the knowledge, has the skills to assess an individual and find out what is your problem, and this is how we are going to address the problem. So yes, it's not the concept of no pain, no gain.
All right, so you don't have to feel pain to know that you're actually getting the proper form of treatment. And when it comes to now the proper forms of treatment, let me come to you, Dr. Catherine. What are the different forms of physiotherapy that are there that, you know, are mostly administered to different patients depending on the kind of symptoms that you present with?
As I said, our scope, we're treating patients all the way from, children to the adult. And the problem that they present, for example, if you're seeing a child who has cerebral palsy, it may be that their joints are contracted or tight, they don't have strength, they don't have balance, they don't have a means to walk without falling. So for that type of a child, you are thinking, I need to strengthen this joint, I need to work on balance, I need to maybe look at assistive technology for them to be able to function in their environment. So that could be different than if I'm seeing somebody who might be recovering from a spinal cord injury, where there are some things that I cannot do right now, but I need to do in 2 weeks. So the type of exercise that we do, all of it is called exercise, but to a physiotherapist, the exercise is defined into hardened types. And there are those that are not to do and those to do, depends on the time. So if you came to me and maybe you had your shoulder and maybe you were playing tennis, you did something, you tore up your shoulder, and the doctor went in and did a procedure, there is the therapeutic type of exercise that are fit for you at week 1 versus week 4. Because I can damage your graft if they grafted your shoulder. So there are those patients who you think, if let's example, if you're doing a head injury patient, the type of exercise that you provide is different from the type of exercise you give to somebody might be with their multiple sclerosis. So they are all very different. So we do things like therapeutic exercise, balance. Right now we have really progressed in technology when it comes to robotics, and soon coming to Kenya also, where for those joints that are not able to regain their movement, where they can use instruments to pursue that and to adapt. We use a lot of assistive device because as Henry said, our goal is to make you function at the highest level possible in your own environment. So if you are paralyzed from your waist down and you're a producer and you need to come to work, what do you need to do? So we train you to get your balance, to be able to get yourself from maybe a chair to the car, lift, be able to function. So if you have to go stairs with your wheelchair, we have to teach you how to use that. So the type, so we can, if it is pain, we can do things that are short-lived, like ultrasound, electrical stim. Those are short-lived. They don't really go in to cure the problem. And what Henry was saying is, for us, we are looking at what is the cause. So we are not going to massage around a knife that is in your chest. We are going to look at that knife, take it out, and then we will structure the tissue that has affected. So every condition, and the range is big. I hope we will have an opportunity to talk about the range of the conditions that we actually treat, because we do a lot of conditions.
And speaking of the conditions, there's one tweet by one lady called Daisy here on Twitter who's asking, I was advised to go for hydrotherapy to help with disc prolapse that I had. Is this the right way to go to help me recover? Disc prolapse and hydrotherapy.
Great. I think that's accurate. We're looking at the bigger picture. What is hydrotherapy in the first place, and what is disc prolapse? So disc prolapse is a medical diagnosis, and there are many, science says that there are many who has disc prolapse and they don't have symptoms. It's normal. You see, like my face, 10 years down the line, my face was a little bit smoother than today. Another 10 years from today, it will change. That's normal part of wearing off. So the same with our spine, they wear off. And most of the time our spine is in activity, like now it's in use and so forth. So that's normal part of wearing off. That should not really make the patient feel like, yes, my disc is out, will it can't get back? Really, there's nothing like it will get back or it will what. As long as you are optimally functioning. So hydrotherapy is treatment. It's a form of physiotherapy treatment whereby you use heated water, certain temperature that's absorbable to the body. So you do a range of exercises in water, and you go in with a trained physiotherapist. Now, the exercises you are given are tailor-made or customized based on your needs. So basically, what are we looking at hydrotherapy and disc prolapse? We are looking at trying to stabilize those, to activate your core muscles so that your spine can be stable in the midst of your activities. So yes, it's a good treatment for her.
All right, so Daisy, I think that there is your answer. Hydrotherapy is good for disc prolapse, and I believe disc prolapse is when the spaces between the backbone collapse.
So
in general terms of speaking,
to make it simple, is easy. Like a balloon, a balloon. You can compress the balloon, and when you compress it like this, the sides expands. So the same with the disc, because of maybe any other issue, maybe mechanical pressure, a lot of weight. So there's that compression force, and the side of the disc herniates or protrudes out. Okay. That's what we call prolapse.
All right. So there you have it, Daisy. Tuache kujidiagnose na kujitibu, and according to Daktari here, that is a proper way of treatment to help with your problem. Keep sending in your questions, comments, or any clarifications that you may be needing in regards to this particular conversation about physiotherapy. We are here to help you be empowered and understand what forms of treatment you are getting. Tusiache kuingia kwa ofisi ya daktari and we don't know what we are going in for, and at the end of the day, information is power. So the hashtag is still Good Morning Kenya on Twitter. Now let me come back to the society in itself of physiotherapists when it comes to just making sure that we do not have quacks who are parading around calling themselves a physiotherapist and ultimately causing more harm to patients. How are you as a society just making sure that when it comes to licensing and registering physiotherapists, at least according to your society, you are per the book and everyone has been licensed that is under their society?
A very good question. And as we know, honestly speaking, that in terms of regulations in this country, healthcare industry is one of the highly regulated industry because just of the risk that is associated with it. So as Kenya Society of Physiotherapists, we are not mandated by law to license physiotherapists, but it is our mandate to provide trainings, continuous professional development, because there's a lot of changes day in, day out. We provide information that are relevant to our patient needs in the society, so that our physiotherapists are updated at all the time. Without saying much, Kenya Society of Physiotherapists, as per the Physiotherapy Act 2014, we are mandated to help in the formulation or the composition of what we call Physiotherapy Council of Kenya. Now, it is the council that is the regulatory body. It has the authority or the mandate to ascertain that the said physiotherapist who is going to offer these services is duly trained, registered, and licensed to carry on. So we have a regulatory body that is in charge. If you are found to be training without licensure, you can be prosecuted. So it is a law that is in the Act of Parliament. So our role as a physiotherapy, Kenya Society of Physiotherapy, is to promote learning forums, but to work with the council to make sure that all our patient population are protected by the genuine physiotherapists. And when I talk of genuine, it's trained and licensed. And it is important for our patients to ask the said physiotherapist who is attending to you, are you licensed? Because we have a very small, nice card, licensure, like a passport, that just say, yes, I'm licensed.
How have you had patients actually do that? Ask you before you start the treatment process?
Yes. Where I practice, you have a name tag and you have a license. So they're able to verify. They know who is attending to them. So they're able to verify that, yes, are you licensed or not licensed?
Dr.
And sorry to cut you short,
no worries.
Especially in healthcare setups where we use most of the sponsor for paying is insurance. Insurance are now very keen. You must prescribe your name against your license number.
Okay. Have you had the same situation when patients ask for your registration to just see it before you go ahead with treatment?
What we do is we post them. So that you can reduce the burden of the patient having to ask. But we also talk to them about it. Of course, there is the issue of trust, and that's something that we have seen in the population where when you say you're a doctor, the patient automatically has that level of trust. So we want to encourage Kenyans to have the courage to ask, not just are you licensed, but even when the treatment is prescribed, that you can ask why. why am I being asked to do this exercise? What's the goal? Because sometimes we find, anyway, in literature, if the patient understands why they're doing what you're prescribing to them, chances are they're going to comply.
Okay.
And yes, so we ask that, ask your clinician,
are you
licensed?
Yeah.
Can I see it? It's not an overreach.
And it's not a crime.
No, it is okay.
All right. Now, when it comes to physiotherapy, do you always have to have some form of ailment to go for physiotherapy, or it can be part of your lifestyle? Let me start with you, Dr. Catherine.
Basically, as we said, when it comes to health promotion, the way our bodies were made is we have to be in motion.
Yes.
Without motion, which we call physical inactivity. Physical inactivity is what we have found right now leads to these non-communicable diseases. The non-communicable diseases like diabetes and hypertension. And during COVID, you have seen what that has done to the people. And it may have started with just a reduction of physical activity where there is, you can ride in your car, on a motorbike, on a tuk-tuk, and come to work and sit. So when you look at in 24 hours a day and see how much time have you actually involved yourself in exercise that has value, not walking from 2-3 feet, but exercise that is planned, is good enough time. So we find there's a lot of physical inactivity. So we end up having these NCDs, and then COVID comes, and those are the patients who've had a lot of hit on that. So yes, you can start your physical therapy early, prevention.
Yes.
And then you can progress it now to curative if there is a condition. So majority of the people that come to us, are those that already have a movement dysfunction.
They started presenting some symptoms.
Yes, the symptoms have come. And unfortunately, a lot of other big number come when they have tried everything. And it looks like it's failing, and now they remember us.
Okay.
So we're trying to fix things that sometimes have adapted, or somebody has even lost their job because the pain has been there. But what we educate people is come to physio early, because the earlier that we can see you after somebody has had a stroke, as quickly as you get stabilized with your symptoms, instead of going home and now your life stops there, go to physio so that you can now regain your function. If you have had a surgery, if you have had an injury playing on the field, or it depends on how you got it. Seek services early so that you can resolve early and go back to your life.
All right. And Henry, what are some of those symptoms that we need to look out for that maybe we have been seeing them, but we just sweep them under the rug? What are some of those telltale symptoms that we need to be very careful about when it comes to seeking physiotherapy early enough? The common ones that cut across board.
The common ones, if you have any kind of discomfort that eases or gets worse with certain movement. So for example, you say, if I lie on my right, I feel more pain than when I lie on my left. We call it mechanical pain. If you have any kind of pain that you can provoke it and ease it, come for evaluation to find out what is causing your pain.
Okay. Come for evaluation.
Okay.
Any more?
That is very simple. Then there are many. There are really many. That's just a basic one. But we can spread it across. It's quite wide. We cannot exhaust it today.
Yes.
But we have different sub-speciality that we rarely talk about it. Like for example, when it comes to we call it women health. Okay. Do you know physiotherapy has a role? Not only in women health, but in man health. There we are looking at the structures around your bowels, okay? So you could be having issues to do with incontinence, that you are shy, you can't share. I mean, we've met different people, they tell you, when I go for meetings, I have to carry like 3 panties. So I just keep on checking because the urine leaks, okay? Feel free to approach a physiotherapist to share, and they'll be able to do an examination, find out what could be going on.
Okay. Dr. Catherine?
Yes, if I could add, and that's very good. He tackled with pain and women's health. We're talking about developmental delay in children. When you see, your kid is 14 months, they're not walking, or they're 6 months, they can't sit. Those
hitting
delays,
the milestone rather
those
slowly
milestones, it's very important to stay on keen so that you can start getting, the children can get help. Or all of a sudden you feel like you don't feel strong and you're not able to pin down what it is, or you're stumbling when you walk, because some of those are nerve conditions. Dizziness, sometimes you have vertigo. Sometimes it's from, as he said, just injuries that you get through life, because we do that. And sometimes it's every time you go to work, in the end of the day, your body just feels off. And maybe it's your ergonomics, how you sit, the position, because sometimes it can be a one-time visit to a physio who advises you on what you need to do differently. Sometimes I have patients who come and tell me my back hurts, and it's always in the morning. And we look back at, is it the mattress? Is it the position? Is it that you're weak? So, as he said, we're looking at the whole body. So what could be the cause? Is it because you suffered, somebody has Parkinson's? Sometimes you see that in older people when they start to slow down their walking, and you're thinking it's just the aging. We need to age well. We don't have to suffer physical disabilities as we age, and some of that is our scope, where we now come and show you what you need to do, even some of it on your own. So not just pain, but it could be even after surgery, after cancer treatment, when you lose so much muscle power. Right now, the majority of the people we are seeing is after they've been in the hospital for a prolonged period of time, you lose a lot of muscles. There's no pill out there to take in to get bulky or to get your muscles back. It goes through training. So you come into a space quickly, and so that you can get your function and go back.
All right. As you can see, physiotherapy it's a holistic approach.
It's holistic.
It's not just narrowed down to Indio Shida, this is how you address it. Here are pills, do this, you'll be good. It's about looking at the root cause, which could be something totally different, like your mattress. People. All right. Now, there's one Kim here who's asking, what form of physiotherapy is best for expectant women? And especially talking about back aches, because I can speak from experience, that was a big problem. Let me start with you, Dr. Catherine, before we come to you, Henry.
Now, as we know, pregnancy is not an illness. It's a state of life. It's a beautiful phase of life. Some of the things that we see with pregnant women, especially if you add a little bit more weight, is that the curve of your back tends to become bigger. And as your curve of your back gets bigger, and you're going forward, then the structures of your back are impinged. So you find many people will have that problem. Now, one of the things we say is, if you now wear like your high heels on top of that curve, and we know high heels, what high heels do
in general,
we love them, but they lift your stomach forward. You kind of it makes your buttock a little bit more prominent, but as you do that, you also make your back travel forward, and long term it will give you a problem with your back. The same thing, the same shape it gives to pregnancy. So we encourage mothers to maintain moderate exercise, especially walking. Very important until that time. And some of the people will walk up to even 9 months. They'll walk that morning, go have a baby. Water exercise is good, but I know that may not be in reach for many. Still keep doing your resisted exercise with little weights in your hands. If the pain is a lot, and sometimes you'll find mothers will have pain at the back, what we call their sacroiliac joint, it goes off a little bit. We have a little belt that we can give somebody to wear to just stabilize, or the physio can show you some exercises that can help you to release that area that has pain. But the majority of people actually needs to keep moving. We want to avoid lifting badly, and this is not just for the pregnant women, but even for the public, where people don't think, where is my back, where is my nerve, what method should I use when I'm lifting? So we see a lot of people washing clothes from the floor, and we are thinking that's going to be our clients in a few years. They mop with towels, and they bend badly. They use short brooms. Just the way we work becomes a disaster when it comes to our backs.
Okay.
And so we advise, if you know your work is repetitive and it's going to be for a prolonged period of time, then might be left to your service. And you'll see this with our mothers. As they get older, on Sunday, when we go back to churches and you start looking at people, you see how they bend forward.
Yeah.
And they are bending forward because that is the position that is comfortable for them to get off their nerve. And they are not able to straighten up. It's not like they prefer that position, but over time, cumulatively, they have wore their backs because of the things that we do. So it's important for us to think how to take care of our bodies. We need to keep them moving, strong, just like we eat every day, 3 times a day, some people more than that. We need to think about exercise because the 2 components is what makes a healthy body.
All right. We always need to assume positions that come naturally to the body and avoid these unnatural positions that consequently, when you teach your body, it adapts and going back might become a problem. Yes, Dr. Henry.
My parting shot on what Dr. Aria said.
Yeah.
You know, it's a very good question. Take, for example, our vehicles that we drive. We are very good in maintaining them, okay? Especially men. Very good, very
like a service.
Service. You don't have to wait until it has an issue. The same thing we are supposed to do to our own bodies.
Yes.
The way our expectant sisters, mothers go for prenatal clinics, it doesn't harm to have a visit to a physical therapist, to a physiotherapist, just to ascertain that you are moving optimally based on who you are.
Okay.
Okay? So there's a slogan that movement is health. And you can tell that with the pregnancy, there are bound to be changes in body mass, sitting posture, walking. Be a friend to a physiotherapist. As you see your obs and gyna, make an attempt, even if it is once. Just to go for an evaluation. Don't wait until you feel pain. Pain is good because to us it says you are still alive.
And there's a problem.
And then it says there's something need to be addressed. Yes.
All right.
So my parting shot, go for check.
An evaluation.
Evaluation. That's what Dr. had mentioned, that what we call health promotion and fitness, which is part of physiotherapy as well.
All right.
Yes.
So always waddling around like a penguin, you don't have to do that. Just a visit at the physiotherapist could help you with that. And as he has said, movement is all that you need, especially when it comes to our expectant sisters. Now, as we draw the conversation to a close, today is World Physiotherapist Day. What does this day mean to you as a physiotherapist?
Well, I feel like it's my birthday. Yeah. So World Physiotherapy Day, it is 8th September. 8th September, it was brought in together with our mother organization. Our mother organization is called World Physiotherapy, which is based in London. It's a day that we come together as physiotherapists, reflect on what we do, and enlighten the public. And the public is now anyone who is not a physiotherapist, including our own colleagues in the medical field, so that we can just share with them what is our contribution to One Health, what we call holistic approach. What is our contribution? Because no one is a custodian of all the knowledge. Okay? I cannot know what is going on in this house. I cannot know entirely what a physician does, because they have got different specialty, but approaching or addressing One Health. So it is an opportunity for us to come, as you've given us the opportunity, to enlighten the public. What is our crucial role in the management of patients? But this year, the theme was tailor-made to COVID. So we are out to enlighten the public on the crucial role as a frontliner in COVID-19. What is our contribution to your recovery as a patient? All right.
And maybe on the same breath, Dr. Catherine, the relationship between the physiotherapy and COVID, briefly as we draw the conversation to a close, and how physiotherapy can help in the process.
When COVID came upon us, as the rest of the medical team, we had to evolve quickly to understand what's the science behind what's happening to the patient and what our role is. The fortunate bit is that physiotherapists, even before, were involved in acute care, ICU management of patients. And most of the COVID patients were having the issues of their respiratory system, their lungs. And so what we had to do quickly is to learn from the science that was feeding from the wild is exactly what is the best techniques to use to optimize breathing, because that's where the issue was.
Okay.
So for those who are on mechanical ventilation, looking at what can we do before to keep them from having to go through mechanical ventilation. And we found things like putting them on their stomach, which we call prone, was helping to get the air in better so that you avoid them getting on the ventilators.
Okay.
Those who are on ventilators, to make sure that we use the right method to be able to remove the secretions, because if you're flooding in secretion, it's very hard to breathe. And so we had to use the better methods of getting those secretions out. Those who are getting weakness because of being in ICU, you have to prevent that weakness, because as you're staying in the ICU, that happens. And then after you come out, following up to make sure people regain their strength. Those who are getting their lungs are scarring, how to improve their capacity. So in COVID, we have been involved from ICU and now all the way to outpatient and community.
All right.
Yes.
All right. So in brief, that is, the relationship that is there between physiotherapy and COVID-19. And in as much as we would love to continue with this particular conversation, we have to put a cap on that conversation, or we definitely make more time for it. But do stay with us. Remember, we have been talking with Dr. Catherine Wambua. She is the Secretary General at the Kenya Society of Physiotherapists, as well as Henry Opondo, who is the chair of the Kenya Society of Physiotherapists. Thank you very much for coming in studio to enlighten us more about physiotherapy. We appreciate you for your time.